Hello everyone, let me introduce myself. My name is Lisa Wade, and today I will be presenting a speech about Lyme's disease. The purpose of my speech will be to inform the public about how Lyme's disease is contracted, the clinical features, prevention, and medical treatments, as well as how it can affect the quality of your health and life. I will present the article from the National Academy of Sciences by Alan C. Steer, as well as my own personal experience with Lyme's disease in today's presentation. But before I begin, let me show you my two index cards. The first one, if you can see it, has the author's name and the title of the article, as well as the quotes, and the second one has my 3 points. And now I will show you and introduce you to each of my audience members.
Brandon Wade.
Angel Shear.
Joanne Wade.
Cole Wade.
Dwayne Wade.
Oh, let me adjust my camera. My face is not showing. And now I will begin my presentation on Lyme's disease. Author Alan C. Steer, A Growing Threat to Urban Population, discusses the many ways that Lyme's disease can affect our health and our life. Lyme's disease is caused by the bite of an infected tick that has Borrelia burgdorferi. Lyme's disease can dramatically impact the quality of a person's life and health, and as Alan C. Steer said, is a threat to urban populations. It's a complex disease that's often misunderstood and misdiagnosed. Therefore, today, I will discuss 3 points that I feel are important to know about how Lyme's disease is contracted, the symptoms, and the treatments. The first point that I would like to make is how Lyme's is contracted, how it's transmitted, and how it's prevented. From 1982 through 1991, 40,195 cases of Lyme's disease were reported to the Center of Disease Control. Focal areas of outbreaks are those that are ecologically favorable to deer. Lyme's disease is contracted from a deer infected with Borrelia burgdorferi that attaches itself to its host. The risk of acquiring Lyme's disease is 1.2%. And for the tick to transmit the disease, it needs to be on its host, which can be an animal or us as humans, for at least 24 to 48 hours. Protection is key in prevention of contracting Lyme's disease. Wearing the proper clothing when out in wooded areas, pastures, and grassy areas is vital, as is the use of tick repellents that contain permethrin. You can't just use any type of repellent like mosquito repellent. It has to be a special type of repellent that repels ticks. Although it's important to understand how Lyme's disease is contracted and prevented, it's equally important to recognize the symptoms of a tick bite that has infected you with Borrelia burgdorferi. For my second point, I would like to talk about the clinical features of Lyme's disease, because early recognition affects the outcome of treatment. During the first stage of Lyme's disease, a person may notice a rash, and it may form localized and in the shape of a bullseye. And there also may be multiple forms all over the body as well. As the disease progresses, some symptoms that may occur may be meningitis, facial palsy, muscle and joint pain, and in the late stages of the disease, clinical features may include symptoms of neurological abnormalities, difficulties with your memory, chronic fatigue, arthritis, and heart abnormalities. The later stages of the disease may be more difficult to treat, and it may affect the quality of a person's health and life as well. The symptoms of Lyme disease may last for a short duration or a long period of time. It is vital to know about how early testing and treatment can prevent and shorten the duration or actually help a person recover from Lyme's disease. The third point of my discussion, I will address the methods of testing and treatments available for Lyme's disease. Serological testing is an important and initial step of diagnosing Lyme's disease, and this is done by having your blood drawn and getting labs, and it's usually confirmed in the lab most of the time that you have Lyme's disease, but not always. A lot of times doctors have to rely on clinical features such as the bullseye rash or other symptoms, as well as the serological testing. Treatment for Lyme's disease is often started when the clinical symptoms become present. Two of the frontline treatments are amoxicillin and doxycycline, and these are given in oral doses by mouth. And typically they work most of the time. You may have to repeat the antibiotics multiple times in order to feel better or to kind of suppress the Lyme's disease. And in late stages of Lyme disease where you have neurological symptoms, you may have to be treated with IV antibiotics such as ceftriaxone, and there may be a need to repeat these treatments with these medications, IV medications as well. Lyme's disease, especially if a person is suffering from Lyme's disease, may have problems with their memory, bone and joint pain, depression, anxiety, neurological abnormalities. You may have trouble with your eyes, your liver, your bladder. So I want to discuss just for a brief moment about my journey with Lyme's disease. A little under a year ago, I ended up in the ER with what I thought was a heart attack. I was having heart palpitations, and I was referred to a cardiologist. Within the next few weeks, I began breaking out in the bullseye rash, and I started having chronic fatigue, migraines. I was put on migraine medication and told that I was suffering from migraines. I was barely able to get out of the bed. My joints were aching. I had fevers, and I continued to deteriorate until I ended up back in the hospital and was diagnosed with Lyme's disease. I had to take 2 rounds of doxycycline, and I still continued to take medications from time to time, and I still struggle with memory loss now, anxiety, depression, sometimes a little bit of insomnia. That was not one of the things that I talked about, but people do suffer from insomnia. So in conclusion, I have given you a vast amount of information that I would like for you to consider about Lyme's disease. I feel that it's important to understand this complex disease and how it can affect your health and quality of life. So let's review. Lyme's disease is caused by a bite of a tick that is infected with Borrelia burgdorferi. Contracting Lyme's disease may have a significant impact on a person's health and life. I've given you information about how Lyme's disease is contracted, how it's prevented, how it's diagnosed, and how it's treated, and how it has dramatically impacted my own life. I feel that knowledge is imperative in helping prevent and receive early treatment for Lyme's disease. Lyme's disease can be treated, but without treatment it can cause a decline in your health and quality of life. Everyone knows the phrase, knowledge is power, and in the case of Lyme's disease, knowledge is the power for prevention, recognition, and treatment of a complex disease. Thank you for your attention, and this concludes my presentation for Lyme's disease. I would now like to thank each of my audience members for participating in my speech. Thank you, Brandon. Thank you, Angel. Thank you, Joanne. And thank you, Doyle and Dwayne. And thank you, everyone, for listening to my speech.